It's okay on my end.
It's wonderful. Thank you. Welcome everyone back to the Your Life Your Way show. I have a wonderful guest today who's going to speak to us about a topic that is a little bit personal to my heart. But first of all, I want to remind you that Your Life Your Way is where we talk about all things that help support you living life on your terms so that you can age well with less stress and more life. We get so tired of being and doing how the rest of the world thinks we should. So we're here to support you getting out of that and into your own life. My guest today, Tiffany Ludwicki, is the creator of Mind, Body, Mouth. And this, why it's so personal to me, is this will touch me in our conversation regarding my mom, which Tiffany and I have talked about. But Tiffany is a dental hygienist, and with her mind body health, she has preventative strategies to stop mouth breathing and reduce snoring and apnea events. How can you stop snoring? How can you wake up feeling rested without meds and machines? I know my dad used to use a machine that sounded like it was taking over the world. How you can increase energy, reduce anxiety, irritability, and pain, and improve relationships, all by understanding mouth breathing and how it affects your life. When I first came across you, Tiffany, I saw a post on social media about mouth breathing. I went, oh, I need to speak with her. My mom is a terrible mouth breather. Terrible mouth breather. We've talked about this in a previous conversation. So can you begin first by telling us a little bit more about you and what led you to this path?
Yes, definitely. And thank you for having me. And I know the greatest impact I've had is for people who have physically seen the issues that we're going to talk about and knowing they wish, like, we can't change what we don't know, but just knowing the awareness was there and being able to, what you're doing is now share to save other people's lives. So it's wonderful. And again, thank you. Um, yeah, so as you mentioned, dental hygiene is my background. So I know about the effects of mouth breathing on how it dries out people's mouths, and it can affect our oral health, the bacteria in our mouth, what gets into our body. But beyond that, I've trained as a myofunctional therapist. So it's pretty much physical therapy or personal training from the neck up. And what that does is it works on the muscles of the face and the neck, the jaw joints, posture, and nose for breathing in order to train the muscles to properly breathe through the nose to get the right oxygenation, to keep our lips sealed and our tongue in the proper position. So we not only optimize our nasal breathing, reducing the bacteria dysbiosis, but we're actually keeping our tongue out of the airway so we get the proper airflow day and night. Because many of us are suffering with the snoring and sleep apnea. And the people I impact most actually are the people who they think they might snore, but they're pretty sure they have apnea, but they don't get diagnosed because they don't meet the disease version of it. They haven't quite met the threshold. So those people are actually the people I really want to help because they don't have other solutions. And if I can prevent them from reaching sleep apnea or reduce their levels, I can bring back their vitality and really help improve emotional, mental, physical health in general.
Much it affects. When you and I spoke the first time, I had mentioned too that I have had clients that I include a certain a level of adaptive yoga in my programs, and watching someone work through poses and breathing through their mouth, I find that they're tiring much quicker through the practice. I watch my mom and she's exhausted throughout the day. And I notice that when she's in the chair and she dozes off, immediately her mouth opens up. And I'm just so curious because I know that it's not healthy, but I have not researched it a lot. Is it a habit? Now you said you have the myofunctional therapy. Is that something that, let's just say, just tell us more about it. How successful is it in helping someone break this habit?
It's very successful. Really, an assessment is what we need to determine whether or not someone can functionally breathe through their nose first. There are people with severe allergies where the ability to breathe through their nose is restricted because of inflammation. And then there's deviated septums. Deviated septums generally come because of a tongue tie, an oral dysfunction since birth that did not allow the tongue to go in the proper position to grow the palate, which is the floor of our nose and sinuses properly, which then squishes everything in, creating a deviated septum with lifelong side effects. So being able to address this as a child is life changing.
Is that
Um,
something that's missed at the dentist, or it can be seen or not seen at the dentist? There you go.
Generally, it's common to say, oh, when you get older, you're going to need braces. And sometimes they might expand the palate, but oftentimes they'll pull teeth out just to make room for a
That's what they
small
did to my
mouth for teeth.
sons.
And that's what I did to myself. Well, I didn't do it to myself. My mom did, but sorry, mom, but thank you. Yeah, so instead of trying to grow a larger foundation, they just kind of make teeth come out to fit into the spot. But then I don't know with your son if everything relapsed. I know as I got older, my teeth went back crooked again because I didn't change the function of the muscles which are pushing the teeth back where they were in the first place.
Boy, that fits so much of life, doesn't it?
Yeah, yeah, muscle dictates bone. And if you are sucking in all the time, well, guess what? Those teeth are going to go back into a condensed little position that you create for it. Whereas if you make your tongue your natural retainer, you don't need to wear a retainer for braces for the rest of your life. The tongue
Something
supports you.
doing you're going to tell us more about, but I
Mm,
see it as a child. But what if you said you started to see movement again? So what did you do? Were you
mm.
able to use this technique to give yourself more space?
Some people get a minor amount of millimeters. I might say, like in the waiver, you could get slight teeth adjustments, but it's not going to, the forces aren't strong enough to put the teeth back by just having the tongue there because it would need 24/7. Like braces are 24/7 forces to put things there. But we talk, we eat,
Yeah.
we rest and exercise. There's a time where mouth breathing is essential during certain stressful parts of exercise. Ideally, you can work to the point of keeping your mouth closed. If you've seen runners and the tennis player who played tennis with the lip tape on to show people, like,
Oh,
look at the
really?
energy I have when I breathe through my mouth instead of my nose, like an Olympian. Uh, so yeah, it's not enough forces to put the teeth back where they should have been, but it prevents it from the relapse. Myself, I would have to wear my retainer, which I got done. My teeth are still not perfect because they moved, but then I got a retainer done where they are now because I'd already had braces and Invisalign twice before learning about this. I couldn't go 2 to 3 days without it hurting to get my retainer in. Now I can go weeks and I'll put it in just for fun, just because, I'm not perfect and you know what it is. And sometimes it might feel a little tight, but generally I get my retainer in after weeks and my teeth have not moved. Whereas it would have been days prior to. Yeah, which is nice because then you don't have the stinky breath that sometimes
Yeah.
comes with retainers and yeah. So,
What is the effects of mouth breathing on our?
well, let's think about, okay, first I'll tell you, yeah, I'll answer your question more specifically. When we mouth breathe, we are generally taking in oxygen and then we're breathing it out. It's not getting into the deeper parts of our stomach and our diaphragm, and it's not adding a chemical, nitric oxide, kind of sciencey here, from our nostrils, which dilates the blood vessels, opening the blood vessels, which then allows oxygen to leave the blood and go into the cells. So when you're mouth breathing, your cells are not getting the oxygen that they need to create energy. A single cell will create 2 units of energy in an oxygen depleted state. Whereas if you have more oxygen in the cell to help the process of energy production, you get 32 energy. So
Hmm.
imagine all the cells in our body getting 32 units of energy versus two. Big difference. You then have that ability for your body to heal and detoxify better. All of your cells are functioning more optimally. It's getting the jobs done for you. And so you're actually able to heal the body and you're less likely to have those cells, the senescent cells that are partially broken down from either like repairing or getting depleted from the body. And so you have less accumulation of like dead broken cells that can contribute to cancer in the body. But also, if you think about at nighttime, if the heart then is getting less oxygen and you have any micro arousals, like you don't have to have a 9 second sleep apnea event, you could have an 8 second one every single minute, which is technically apnea, but it's not diagnosed because it's not 9 seconds. So the heart then has less and less oxygen, and then you have an episode where you're like, oh, I didn't get enough air. Well, that's like starting a race right at the starting line. You now all of a sudden you put your body and your heart under stress to wake you up to save your life. And so the heart then has multiple running a race all night long. So there's a reason why like snoring, people are 24 years old and they die in the sleep of a heart attack. their partners down the road, yeah, they snored all the time. Their mouth, breathing the minute they fall asleep. It's because their heart was depleted of oxygen all night. It couldn't withstand the energy requirements for all those mini wake ups throughout the night. It
Wow,
was just too much on their heart.
that's very sad.
So I actually think snoring is worse than sleep apnea for that
Wow.
reason.
Hopefully, you have even more joyous things to tell us as far as how to solve these issues. But you can, before we get into that, can you tell me that we discussed effects on the body and the heart? What effects does it have on the brain?
Yes. So for anybody who may have parents dealing with Alzheimer's disease, mouth breathing is actually, it's like a two times the risk factor because, well, the mouth breathing, again, the not getting oxygen to the brain at nighttime. When you're not getting oxygen to the brain, again, your brain can't function optimally because it doesn't have the energy, and the brain is more active at night than in the daytime. On top of that, when we are having, when we're mouth breathing and we do have potentially little mini episodes of loss of breath or loss of oxygen that your body might respond to, you don't reach deep levels of sleep. So you might arouse during a deep stage of sleep. So the body doesn't stay in the rest and repair stage long enough to detoxify the brain. So you get more and more accumulations of plaque in the brain, which then it accumulates brain fog. We generally see the effects of Alzheimer's starting as mild cognitive impairment in your late 30s, early 40s. And it just kind of gets worse and we just allow it. But Alzheimer's actually starts like in our 30s. And that's when it's preventable. It's not preventable once it's past the severe cognitive decline, but you can do things to help at the age when you start to recognize these symptoms, especially if you're mouth breathing or have snoring or sleep apnea. And obviously, like sugar and stuff makes a difference to our diet because that creates sugar has its own processes in the body. But I'll skip down to the twofold. So that was the airway and the breathing, but then the oral health side of things. When we're breathing through our mouth, we create an acidic environment in the mouth, which then contributes to less good bacteria, more bad bacteria. And then when we have more bacteria in our mouth, we can get a little bit of bleeding in our gums, or a lot, hopefully not a lot. But if we have bacteria that's creating bleeding gums, blood can come out. Well, guess what gets in? That bacteria. The bacteria gets into our entire body. And if you happen to be somebody who has any bit of cognitive impairment, if our brain is what's creating inflammation because we're not detoxifying, well, those plaques, the bad bacteria, I should say, from the mouth have been found in the plaques of people with Alzheimer's disease.
Wow, I've heard
So
it going infecting the heart, but I've not heard it going and affecting the brain.
it's
Wow.
almost more connected to the brain than it is to the heart.
Wow.
Yeah. Yeah. In the plaques of people with Alzheimer's disease. And there's been many studies, like there's a lot of, is it beta blockers or there's medicine out there for Alzheimer's disease, but it doesn't cure Alzheimer's disease. They're not finding that that's the real reason. So your glycemic control has a lot to do with it. And if you are mouth breathing, your requirements for energy are higher. And so you're actually pulling, even if you're not eating sugar, you're pulling more sugar from different cells and organs in the body, and you're creating a higher glucose concentration in the blood to try to create energy because you don't have enough oxygen energy, the stuff that's really, really beneficial. But yeah, you can have healthy people that eat really good. They still have early diabetes. It's because
I
their
was just going to
sleep is
say, how
off.
does this affect type 2? Because my
Yeah.
mother's she's her A1C is lower now, so she's technically out of that level, but she checks her sugar every day, and we still have to watch because there is such a fluctuation when she doesn't, for example, move her body a lot. So how I know would have never would have thought it would have an effect there.
Yeah. Well, people who snore and have sleep apnea are usually considered overweight. Like that's been the stereotypical form, right? But like myself, I used to snore. I'm a very fit, healthy, active person. I no longer snore. That was a side effect of learning this treatment to save my daughter. And then I'm like, I don't snore anymore. My husband doesn't need to wear specialized earplugs. My energy and everything is better. So it's not just overweight people like with diabetes and stuff, but it's small people who, for some reason, can't figure out why their glucose control is so bad. But if they are snoring and mouth breathing, they're not getting cellular oxygenation. So their bodies need to create sugar because that's the other form of energy. So it's going to pull sugar from your liver, right? So your body is going to make its own sugars. And it's scientifically proven. If you probably Google this just right now, does a poor night's sleep increase my blood sugar in the morning? The answer is
Uh-huh.
yes, it will, because your liver has been trying to give your body the energy it needs to heal at nighttime. But really, the liver should be detoxifying. It shouldn't have to be working so hard, but it has to in order to survive. And your body is going to choose airway first. You can only go minutes without air. It's the most important.
True.
It is going to put everything else aside. And so that's why we find little things down the road that just aren't working as good as it should, is because our body and our brain have to prioritize the most important aspects of life. And blood sugar is probably one of the second things, right? Because if our blood gets too acidic or too alkaline, like that's deadly. So breath and like sugar, diet, most important. The tongue, guess what? The tongue is the muscle for both of those things.
There's so much to learn with the body. The body is just fascinating, and there's just so many things that you don't know. How would we know unless we're talking
Yeah.
to people like you to learn these things? And it's greatly appreciated because I find it sometimes a little scary the way I hear her breathing because she gasps and it's you don't know what to do. It's become such a you think it's a habit, but it's not just a habit, it's a physical condition. So how does one know that if you don't know you're snoring? Did you know you were snoring if your husband didn't tell you?
I knew that I was. I thought it was funny. Like I've woken myself up with a snort like plenty of times. Like I've fallen asleep on the back of my husband's motorcycle. I hit the minute I hit the pillow, I'm out cold. That's bad. You should take 2 to 3 minutes to fall asleep. You should not fall asleep right away. It means you're overtired. Your brain is exhausted. But yeah, no, he wore swimmer's earplugs. He had bought many types of earplugs. He would bring them home from work, try them. The swimmer's ones seemed to be the best for him, and he would wear them. We just kind of laughed at it. I didn't know snoring was a big deal. We tend to like think, especially with kids, oh, it's so funny. Like, look at their snoring. It's so cute. They need their sleep. They're so tired. No, they're gasping for air all night. They're being silently strangled all night long. It's not cute.
What was your point of saying something's wrong? I need to check it out.
My daughter was born with sleep apnea, an infant. We weren't getting sleep. That happens with all parents. Time went on a little bit more. I was referring my dental hygiene clients to sleep studies. And then I found out about this myofunctional therapy thing. I had a conference come to town and I learned about it. I just did an intro, like 2 hours. I'm like, that's interesting. And then I'm like, wait a minute, my child is born mouth breathing. Children should be obligate nasal breathers. So I'm like, there's something here. So it was COVID. It was 2 months into COVID. So everything was shut down. The course was online. I'm like, I'm signing up for this.
Mhm.
I'm off, sitting there breastfeeding my baby while learning, doing all these funny exercises with my mouth, practicing breathing techniques. And by the time I even graduated the course, my husband was like, "You're not snoring anymore." He no longer
Really?
needed earplugs, I mean, and it hasn't been an issue since. Maybe once every couple months, if I do get some seasonal issues, some stuffy nose, it becomes more challenging to breathe. But I'm not even snoring. I might mouth breathe a little bit, but I'm not snoring because my airways are more toned, my tongue position, it all just allows for more breath to come in.
Okay, I know we're all wondering and we want to know, come
Hmm.
back to your daughter, but I think in order to answer that question with your daughter for us, we need to know what did you do? What did you learn and what did you start doing to help you? And then how did you help an infant with those
Right.
techniques? So you first.
Okay. So for me, obviously we learn about the physiology of breathing. I'll talk about your mom, the sound of her breathing and the habit. Sometimes it is a habit, but the more we mouth breathe as a habit, the less our body is sensitive to like little chemoreceptors like oxygen and carbon dioxide, right? We take in oxygen, we breathe out carbon dioxide. But if you're mouth breathing all the time, your blood oxygen is such a high oxygen level, like the oxygen is not going into the cells, it's staying in the blood. So then your body gets really sensitive to carbon dioxide and you feel like you can't breathe because your body can't deal with the waste. That's why as a yoga instructor, you want long exhales because you want to build up the waste and breathe it out. The more you build up the waste, the more oxygen has to let go and go in the cells. So you're improving your clients by having those long, deep breaths, the slow breaths. You're improving their blood oxygenation. So, anyways, yeah, so we learned about that kind of science. And then the anatomy was already something I knew from dental hygiene, but we learned more about the muscles and how the face muscles are the only muscles in the body that are connected to other muscles. That's why if you have a stroke and you lose the muscle function, your whole face droops because this muscle would hold up this muscle, which is attached to a muscle inside, and all of them are attached inside and outside. The tongue itself, like 8 muscles. You got internal, you got external muscles, and then they're connected in different ways. So You learn how to, instead of sucking everything in and pushing everything inwards, you learn how to relax and stretch certain muscles. You learn how to create strength in other muscles to support the jaw, to reduce jaw pain and headaches and grinding of the teeth. Then we also learned like the airway muscles. The tongue and the lips are connected to airway muscles. So how do you open up the airway? On a sleep study, you might get the results of like optimize your airway. People think, oh, I have to go get my uvula and tonsils and everything taken out. You can just tone and strengthen it so it's not so collapsed and open up your airway naturally without any side effects. So learning those things and then all the exercises through the program, we're learning the exercises, how to start with certain exercises to build up certain muscles so then they can talk to other muscles and they can start to work harmoniously in the body. Because like some people might have really bad posture because of the way that they chew their food. Let's say they're chewing on one side because they've lost teeth over here. Well, this side starts to get really, really tight and the tongue is connected to the shoulders. So if you're chewing funny, you're going to start to get this symmetry. So the tongue is actually connected to the shoulders, to the hips. Okay, so now you're getting hip pain. Maybe it has nothing to do with your hip. Maybe it's your tongue.
Right. Well,
Right
if I
down to
feel
our
this right
toes.
now, because I have a nerve in this arm that runs up, and there's times it goes all the way up through in my jaw. So yeah, the connection makes
Yeah.
sense. Yeah.
Yeah. And fascia, the tongue and the toe are connected by one piece of fascia. So if you have tightness and restriction in anywhere, it could affect anywhere along that chain. So sometimes people with plantar fasciitis might also have GI issues because they have a tongue tie. Or they might find someone in your group, let's say they have jaw pain, TMJ pain, but they also have knee and toe pain, like plantar fasciitis kind of stuff. Well, there's a connection there that maybe there's a tightness in there that has to be released and now taught to work harmoniously together.
Can you talk a
Yeah.
little bit more in detail about the tongue tie itself, and then come back to how you helped this through your daughter with
Yeah.
it being such a little
Yeah,
pumpkin?
I know. Yeah. So a tongue tie. So if there is a restriction that wasn't released during like birth, between 6 months or 6 weeks, you already got your tongue formed in utero and the body starts to open up as you like turn into this little tiny thing in your mommy's belly, this little embryo. And by the time you are at around 37 weeks, that's when we tend to do the proper swallow function. You get the releasing of that fascia. There's a lot of premature babies, right, that might not have been able to reach that critical stage in their development inside when they're protected and ability to finish their proper growth and development. So premature could be a potential maybe risk factor, let's say, and the tongue not opening up all the way. So talking about the tongue tie, like you can stick your tongue out, almost touch your nose, but you could still potentially have a tongue tie. I like to have people move their tongue back and forth. Does their chin move back and forth, or can you stabilize it while the tongue goes back and forth? There you go. You can stabilize it, it stays still. So that's one. The other one is you can open as wide as you can and lift your tongue behind the top front teeth. So there
A
you
little
go. We
more
can
work
open it
there. A little
big.
more work there.
Yeah, but here's the thing. If you held down the floor of the mouth muscles so the tongue works on its own, can you still lift it up? If you
It's tougher.
cannot, yeah, if depending on the extent that you can lift your tongue without using the floor of mouth muscles, will let you know, like, could there be a restriction there? Also, the ability to get the whole tongue up against the roof of the mouth and still open your mouth. Because if you can't get the back of the tongue up to your palate and open up your mouth, well, the back of the tongue is actually held down and restricted. So, in order to talk, in order to eat, you're using compensatory muscles. So the floor of your mouth muscles, if you're someone who has that, like it's really big and bulky right here and the muscles are tight, it's because every time you swallow, you're using these muscles to lift your tongue because the tongue can't lift itself because it's tied. Yeah, jaw pain, grinding your teeth, that's a really good indication as well, is the tongue is not doing what it should be because it's likely restricted.
Well, some of what you're saying, and again, we don't know what we don't know. But if you did know, then I find it, not you, but if it was known, then I find it very irritating because my boys were born at 35 weeks. I had twins. And Cameron, who was born first, I don't know, how old was he? 5? I think 5. And he was snoring and having sinus issues, the whole shebang. And they ended up taking his tonsils and his adenoids. So you mean to tell me it could have been just tongue tie and there could have been so he didn't have to go through all of that?
It's
Possible.
possible. It's
I mean,
possible.
we'll never know, but
Uh,
I'm just thinking for future for people listening. And if they have this issue with their child, talking to you, someone to get more research to find out exactly what is going on versus just sticking with the usual, well, we're going to take these out.
yeah, especially I'm sure he was tested for allergies as well prior to find out if it was
Connor,
allergy related.
I don't remember. I know
Can't
Connor was
remember.
having severe and he did have some allergy testing, but I don't recall Cameron having it.
Yeah, because sometimes there's not much you can do. But if it's because of a habit, like you can regrow those tissues. So there are people and adults as well, they'll get their tonsils and adenoids removed. And within a year, like this one gentleman I'm thinking of specifically, within a year, he was already snoring again, right? He had the surgery. He actually got he got his whole airway cut out, the uvula and everything. And a year after he was snoring again, because he never changed the mouth breathing. He never changed the dysfunction.
And Cameron
So,
also had the sore throat, so maybe that was the difference that it was not this. But it's just good
yeah,
to know these things because not everything is so cut and dry, and the body is so complicated, it's so complex
yeah,
that yeah, it's good to learn more and see what options are and really know what root causes of symptoms are.
yeah.
So take us back to the little one. How did you help your daughter? I mean, being so little, I'm assuming manual.
Nothing manual.
Really?
Nothing manual. One of the biggest things is every time her mouth would open, especially at rest, you push up under her chin. You're trying to literally, you're closing the mouth and pushing the tongue so it would hopefully naturally suction up there to
Hmm.
create that natural suction because, like I said, it's the back of the tongue that needs to go up there. So I would do that frequently. She didn't have the muscle strength to really do anything much else at a younger age. As she was around 6 months to a year, I have a little device. Do I have? I don't have it. It's in my bathroom. It's a little myo munchie. It's a little chewy thing. And so what that does is it initiates chewing motion to hopefully start building the bone cells and optimizing outward strong growth because we tend to like suck and eat a lot of really soft food. So we're not initiating proper bone growth. So I'd start with that and it creates a lip seal. So she can be chewing on that. She's got the lip
Okay.
seal. She's strengthening her lips.
Yeah.
Exactly, breathing through her nose. In addition to that, I have some videos on my Instagram actually, so you can go back and you could see there's a video of her in a stroller, and I'm like, breathe, and she would go. So I would just do really exaggerative like nose breathing. She would mimic me. Children mimic their parents. So if a parent is mouth breathing, a child might think that that's normal to have your mouth hanging out. They're going to mimic that. So there's not always a dysfunction or a tongue tie or an allergy. It could be just mimicry. So doing that and then just like getting her tongue to be aware of the roof of your mouth.
Huh.
And just doing little like exercises. Try puff your face out. I'm doing that with my 3-year-old right
I
now. We're
do
just
that.
doing little puffs. And
Yeah, I do that. Just because
does
it
that,
feels
do you
good to
have jaw
open it
pain and
up.
tightness?
I get here from the nerve, so then I'll
Oh,
sit
okay.
and do, and it does help ease the feeling.
Excellent. So that's a myofunctional exercise because again, because of the connection of all those nerves. So you've found a way. Here's the thing, even with a severe tongue tie, people can compensate in ways that are not bad for them. And so you've just found a way like to do this to alleviate some pain. Like
Mhm.
your body has naturally found something to do to improve its function in day-to-day life. And just some
And I
people
think
need more, some people need more direction in an area that's kind of new-ish.
I think what you're saying, yes, and then having that ability to keep up with it. It isn't
Mhm.
something you do just a day or two and then you're good to go. It's something you need to train yourself to practice it and stay with it. And we know how we perceive life to be that we get so distracted. And
It is something that you commit to. I have online programs for people that my schedule or like finances one-on-one don't work with, but I've taken like all of my experience over the years and created programs that will encompass all of people's needs, just not maybe in a specific order, but the ones that is the most basic progression. And that I give accountability for because like so online so you'd have to like meet and do exercises and there's an order that you have to do it and it's 6 months. I give 6 months of coaching because of the reason what you're saying is you can't just do some exercises and move on. It's like riding a bike, you have to learn balance. You have to learn moving the pedals a certain way. You have to learn brakes, like depending on the type of bike you are. There's so many steps involved. Like you have knee surgery, they're not, let's say the tongue tie, you're not just gonna, cut a knee. You have to strengthen it first, do a surgery, and then rehabilitate it. So myofunctional therapy is like that, especially if you get a tongue tie released. Any audience members, if you go to someone, a dentist, and they're like, oh, yeah, you have that, let's cut it for you. Don't. You could create more scar tissue, creating more body pain throughout the whole body, and you could give yourself sleep apnea. Okay. Like I said, the tongue is a breathing and an eating muscle. Two most important things in life. Don't just go get it cut thinking like this is going to solve even my fibromyalgia, my severe body pain. It can, but you want to make sure that you do the steps to make it actually beneficial and effective for you. But like I said, it does take work. It's very easy, but it takes repetition, right? Like yoga, you're not going to be able to bend over and touch your toes on the first day. You could hurt yourself. So, well, what do? You work on breathing. The more you can breathe with your movement, the more relaxed and fluid you're going to get. You're going to be able to stretch muscles. Your body's going to talk to itself. You have the fascious system, which is our connection to muscle and brain, and you're gonna do it in a way that's appropriate versus looking at someone next to you who can do it and think, I'm going to do that
I'm trying to
today,
get
and then
there.
get upset that you can't, and then you hurt yourself, and right. So yeah, that's why I even say it's like physical therapy, is because people understand that physical therapy is a process.
Well, I am going to have mom listen to this episode. But is there anything that you can offer for someone who maybe is feeling a little concerned now about what you've enlightened us with? What is the first thing that would be the best thing to do first to take the initiative to learn more and to find out about their body and if they fall into this category of tongue tie
Yeah.
or dangerous
Um,
situations?
yeah. Really, you can look and see if there's a myofunctional therapist near you. You can just Google and see if there's someone that you might want to meet with and have an assessment. I do offer a guide where I go and I ask specific questions and I let you, in a way, self-diagnose. I'm like, wow, I do have all of these symptoms. These are my habits. This is my lifestyle, to try to give you a better idea on whether or not it's something that can be changed. Right? What is the reason for it's directed towards snoring because that seems to be what a lot of people suffer with, and they're looking for solutions because their relationship is falling apart. And there's all these reasons why. So it's geared towards snoring, but it's myofunctional therapy. And so there's that guide. And I also do, if people have a hard time kind of deciphering what the results are, I have a personalized sleep audit. So I'm asking those questions, but then I get the results and I then I review everything and I record my findings and then I give them some suggestions, finding a place near them, or if I think they have certain things involved, then, they can go find someone near them, go in whatever order that they feel best. And then I have a free consult call. So people can call me and tell me kind of what they're suffering with, and I can let them know if their symptoms could be potentially alleviated through myofunctional therapy. So I do offer that. And I do even like virtual online assessments. So they can actually send me photos and videos of themselves. And then they kind of get the answers based on their physiology, how their tongue moves. I get them to go through posture pictures and send me a whole slew of stuff so I can then let them know more specifically and individually what route they should go with.
If I
Right?
could touch on that, because some people might think, well, you're in Canada, if I remember correctly,
Yes.
correct? Yes. I think, well, you're so far away. Well, let me tell you, personally, my two functional medicine gals that I love most are not near me. They're in completely other locations. And with the way technology is today, you can access so much information, which we know, but you can have this relationship just as we are now. You can have, and in fact, I've done the taking pictures, the hand, all of that, and I've done and sent. So it is possible. And what I have found, just to help maybe someone ease their mind, that the steps that you have said, in my opinion, in my experience, allow you to feel safe in the process because it's number one, which is a whole other topic and conversation. It's very hard for us sometimes to even feel safe on our own skin and to feel safe opening up to someone else. But the steps that you have given, in my experience, allow that because you can take your time. I don't mean in a way of, oh, I'll do it in a couple of days, but just breathe through the questions, take it slow, send in the information, take the next step, And it's a nice process that you can feel comfortable doing, feel safe doing it, and it gives you a little bit more courage to then do the next step. And sometimes we just need to
Yeah.
have that little bit of feeling of, just like in a yoga practice, I'm all about creating your safe space, your safe pose, not mine or someone else's. And it's the same with going through this with the process of learning what your diagnosis is, what your symptoms are, and how it may or may not affect or is affecting your relationships or whatever in your life. So I would highly recommend looking at the steps that Tiffany is giving and having the conversation, and just know that it is a safe place that you can feel comfortable in finding the places that you need to be and the things that you need to do, and to help you have a whole lot less stress and more life and happier relationships and definitely more energy, right?
That's what we need. That's what we need. More energy gives us the ability to have less stress and
Yes,
be
yes, they
able
go hand in
to
hand.
commit to the other things in life that we have been wanting to, but have been too tired to do.
There's a lot that can be at the cause of being tired, and it's not just the busyness of life all the time. So it's good to do the research. Is there anything, well, first of all, two questions. Is there any last minute advice you would like to offer? And then also I would like to know is, based on what you do and you personally in your life, what does your life your way mean to you?
They almost answer together as one question is
Mhm.
follow your intuition. You have to advocate for yourself in today's world because right now we're all learning things and we're becoming more and more and more tunnel visioned. That it's hard to see the whole person, right? Even between different practitioners, different myofunctional therapists, they're going to come with a different background. There's some speech language pathologists and there's some dental hygienists, but some of them might be addressing different concerns and they might approach life differently and they might jive with you and you might be repelled from them. And that's okay too, because it's personality, it's energy. And
Yes,
I
yes.
think we have to be open to the energy that we get from people because it's not just about doing a thing. It's about being successful in our attempts and knowing when to walk away, knowing when to come back, because timing is everything too. So I don't know if that answers the question, but I think the main thing is like for other people, keep looking until you find, till you get an answer. Like, till it works for you. And if it doesn't, maybe what I do might not be what works for you, but it could be something that you come back to later. Or it could start off like we don't know. And for me, it's like living my authentic self. I was so afraid to put myself out here because my dental hygiene and myofunctional therapy, although I need to have the dental in order to do this. I'm not allowed to practice it. Mind, body, mouth was meant to be a collaborative me, dental hygiene, oral health, everything. I'm not allowed to practice them
Huh.
together. I had to separate my businesses. So I went through a lot of imposter syndrome. Like, can I do this? And I found the loopholes to get out there and do this because it saved my life and my relationship. It saved my daughters and it's helped so many people around me that I was like, I'm not trying to convince the dentist and the hygienist in my area that they should do this, start screening for this. No, I've decided I'm going to let people find me on their own because they have not got the answers yet, because there's not enough professionals willing to step outside of their current paradigm. And so, yeah, the authenticity part and the following your heart and following all of the potentials that have come my way. Everything is like it's like a puzzle I didn't know I had, and all the pieces are coming together. I'm like, if I didn't do that before, if I didn't ask those questions, if I wasn't brave enough to do it, I wouldn't be here now. And I don't know if I answered your questions at
You have.
all.
You have
Okay.
more in abundance. And yes, in everything you've said, and I think relatability is also part of what you said, because yes, it's the energy, but you've also been there. You've been there. Your daughter's been there. So when someone speaks with you, they know they're speaking with someone who understands. And that's one of the biggest things. We want to be seen, we want to be heard. And you can see someone and you can hear them for what they're going through because you've been there.
Yeah.
And on that
Actually, it's
note,
so funny
go
I
ahead.
know on
Go
that note
ahead.
you're about to stop it,
Go ahead.
but before I was a mom, I was dogmatic, I guess, about like these are the things that you have to do. And then you realize, whoa, I did not know how hard life was. I thought everyone had 5 minutes. You don't. And then like just every little piece of the puzzle until you experience it, you can think you know how to help people, but
Mm-hmm.
you can't. That's why I can't help everybody. but I can use my own clients to help me help people and my own experience to help me help people. But if you go by just the science, I wouldn't be able to do what I do now.
Beautifully said. I'm glad you stopped
Mm.
and added that. Thank you.
Okay, good.
Give me, I am going to have a list of, which I already have ready to go, a list of where to find you, but give us one right now that someone can take a note and jot it down and reach out to you right away if that's what they wish to do.
Mind, body, mouth coach would be Instagram, Facebook. If you find Mind, Body, Mouth, you'll probably find me too, but there is another Mind, Body, Mouth in Australia. So I'm not that one. I'm
Okay,
in
so
Canada.
Instagram is Mind Body Coach,
Mind, Body, Mouth coach.
or I do have that. Yes, I do
Yeah.
MBM.
Okay.
Okay,
Yeah.
and that's IG. So that's Mind Body Mouth Coach on Instagram. So if you're looking to speak with Tiffany right away, go to Instagram or Facebook and look her up there and reach out to her. Tiffany, thank you so much. This was so enlightening and gives me much more understanding of mom and just helping her to breathe through her nose as much as she can. And I know she's in physical therapy and her physical therapist is helping her with that too. So thank you so much. I appreciate it. It's been very enlightening and fun and extremely educational. Thank you so much for being with us. And everyone who's listening in, thank you so much for joining us. And if you yourself or your family member or friend you know is suffering from snoring or any of the signs that Tiffany has mentioned, please share this episode with them. Subscribe, share, give us some likes, give us some love, because the more folks we can have listen, the more folks we can have a chance of helping find their way in their life, their way on their terms. So thank you. And as always, I wish you a whole lot of peace, a whole lot of blessings. Take care and have a wonderful day. Thank you.